So, how exactly do you work with couples? I mean, there's lots of different schools of thought on that. There's
Yes.
John Gottman's work,
Right.
there's Sue Johnson's work, and people may not
Yes.
even know what those are.
Right.
Um, but what is it that is your main focus?
Certainly. So it's a little bit eclectic. I will say that first and foremost. A lot of it is your thoughts and principles that are in the foundation of it. Let me say that first and foremost. I'm also Gottman 1 and 2 level trained for those who do understand what that means. And I have had some training within like ITAP, like which is something specifically. Some people might know what a CSAT is. It's something specifically with in regards to pornography addiction and sex addiction training.
Okay.
And I have some advanced training helping the betrayed partner. And so I've utilized that also in helping kind of understand how to rebuild that trust overall. So again, more plainly said, being able to understand and connect how they're communicating and trying to help them to communicate really what they're wanting to communicate. A very tangible resource, which I know you also have utilized, is Prepare and Enrich. I really like that resource to give couples something tangible in their hand to be able to work from also. So it's a bit of a mixture of all of those schools put together.
Hmm. Okay, very
Yes.
good. Have you had any exposure to emotionally focused therapy with couples?
Yes, I have. I've leaned a little bit more into the some of the techniques of Gottman between the
Right.
two, but yes, some of the overall arching principles of how cycles begin, pursuer distancers, things of
Hmm.
that nature, 100% will bring that in also.
Right. Right.
Yes.
One of the things that I would hear from couples all the time was that they had been to a couples counselor and that they would sit in the office and they would argue with one another. And at the end
Yes.
of the session, the therapist would say, "Okay, well, I'll see you next week."
Yes.
And it's
No.
just so
No.
sad.
Yes. Very much
So,
so.
right. And what I would do in the beginning is I would just sit down and I would say to both of them, "So what brings you here?" And
Right.
I would wait to see who spoke first
Yes.
because that was part of my diagnosing the cycle was
Mm-hmm.
to see who spoke
That's
first
exactly right.
and how they approached it.
Yes.
And then I would wait until the other person to see if the other person would interrupt,
Yes.
which was
Yes.
another stage of that because that helps
Yes.
you identify that negative cycle.
That's right.
And then I would make a rule and I would
Mm-hmm.
say, "Okay, I didn't tell you this before, but I have a rule. Only one person gets to talk at a time.
Right.
And I get to decide who that person is.
Mm-hmm.
And sometimes it's going to be me." And
Certainly.
so it worked really well. And
Yes.
then I would continue to work with them. And sometimes I would go into, if someone was kind of flooding, then I would do the talking. I would do like you do, and I would go into
Yeah.
my soft voice and I would do kind of a teaching
Yes.
moment and I would watch for the person to be able to de escalate a little bit
Of
to
course.
see if we could continue. And
Yes.
so that was part of, you know, also I'm assessing what's going on
Mm-hmm.
as well as I'm working on those anxiety reducing techniques,
Right.
those kinds of things. At the same time, I'm evaluating and watching how the partner's responding. So
Yes.
I would almost do, and I'm telling you this because I wonder if this one might help you kind of explain what you do a little bit
Mm-hmm.
better. What I would do is I would pick one person, usually the person
Mm-hmm.
who was the most withdrawn,
Yes.
and I would figure that out from Prepare and Rich,
Yes.
and the person who was the most avoidant, and I would ask them the question first. So, how are
Yes.
things going?
Mm-hmm.
And get them to talk about it as though they're the only person in the room, you know,
Yes.
validate, do all those EFT type
Of
things, or
course.
even Carl Rogers,
Right.
client-centered therapy from the old days. I used to be a professor, so this is
Of
kind of fun to
course.
bring all this stuff back up.
Yes.
But then I would do that, and then I would say, "Thank you so much for sharing that with me. I'm going to talk
Mm-hmm.
to your wife for a minute."
Right.
Okay, great. And I would turn to her then and I would say, "What was happening for you while your husband was talking about whatever?"
Yes.
And then
Yes.
I would do the same thing with her and I would
Yes.
validate what she was feeling. And then at some point, I would help them begin to talk to one another. But just getting them to sit in the same room and listen to one another was
Right.
huge.
Right.
So,
100%.
so do you step in and really take charge of a couple
Yes.
session?
Yes.
Okay.
Yeah. I think when couples counseling works well, the couples counselor is more directive, speaks more in the session because there really does need to be guidance, just as you stated there. And like, just for example, like over the years, and I'm not saying that every couple can do this starting off, but I teach my couples to do this starting off because a lot of people dread couples counseling.
Mm-hmm.
So every my couples know the first thing when they come in, I want them to tell me something good about the other one. So that's always my first question. I was like, tell me something good. And it can be something specific that has happened since the last time we met, or it can be something specific about their character, personality. It can be in general too.
Mm-hmm.
Um, because again, a lot of people start to dread the thought of, okay, what is the other going to say about me when we
Right.
go in? So they
Right.
always know that. And over time, the couples kind of start to get excited about what the other one is going to say. And sometimes they start
Mm-hmm.
to share in the car before they get to the session, which is a
Oh
very
wow.
good thing. And then it kind of switches kind of the anxiety and
Yeah.
kind of mode that they're in. And then I always
Yeah.
will ask, because just kind of addressing the anxiety piece of it, I will always say, we know where we paused last time, but is there anything on either your hearts or minds that you want us to be sure to speak about today before we do
Oh
pick back up where
wow.
we
Okay.
paused? So I always wanted to get that out of the way at the beginning because obviously wanting
Uh-huh.
to honor where they
Uh-huh.
are in that moment. But also, I know there's no way to move forward if they're just holding on to something too that
Right.
they feel like they
Right.
need to voice. So yes,
Right.
being very directive and checking in on with the other one, how did you feel or think, or what was your perspective on what
Uh-huh.
was just shared, is
Uh-huh.
always like the way that each session is started.
Right. That's
Yes.
excellent. Yeah, I think that I would have no trouble referring couples to you. You've got to